Ola Akinboboye and Mike Gibson talking to you about acoramidis in wild type versus variant amyloid cardiomyopathy. Ola, talk to us a little bit about your recent article.
Yeah, it's an interesting article. We're looking at, the response to treatment, comparing patients with wild type, compared to patients who have variant uh, ATTR. And this is something that actually has been, very important because we don't know for sure. When you look at those two populations, they're very different. Wild type ATTR, these tend to be older patients. Maybe there's a bit of a white predominance. And when you look at variant ATTR, younger patients, and when you look at V142I particularly, these are usually younger patients of African descent. So the populations are kind of different. And yes, they both can cause ATTR-CM. The question is, we know there are differences in their manifestations, but what we didn't know is whether they respond the same way to treatment. If the benefits that are derived from a silencer or from a stabilizer in this population is comparable between the two. So we now have the very first, I think the only very clear data set looking at acoramidis in the two populations. And it's kind of nice to see that, yes, they both derive benefits. The benefits seem to be comparable, but we still need more information because the number that we have, particularly for the variant population, can still be improved upon. But this is a good start. It's kind of nice to know that these two populations do derive benefit. It appears equally based on the JAMA study.
Well, how are we doing in identifying the two variants? A lot of people present as the wild type, but how are we doing in terms of identifying people with variant TTR amyloid cardiomyopathies?
Yeah, there's still a lot of work to be done in that area because, well, we still need a lot of education uh, across the board, community education, primary care education, cardiologists, even heart failure doctors. Many of us are still missing cases, and we know in this condition, time is of the essence. Most of the benefits we derive accrue when you treat these patients very early in the disease process. So we still have a lot of work to do in the area. There are still many people, particularly with variant ATTR-CM, walking around with the disease for many years before they are detected and treated.
Well, good to know we have good treatment. Good to know it's consistent in the two wild type and variant subgroups, but more work to do, finding more people with variants and getting more people treated to get those benefits.
Uh,
Ola, thanks for joining us today.
You're very welcome. Thanks for having me.